As I told you, in France, we are working on a proposal that can be a true answer in public policy for true right to food. And we also think about those kind of thing in a special context, with the context of climate change. Joshua, we lost this proposal is really the key point, and Juliette will talk about it a little bit longer at the end of this presentation, is that we built this right to food upon food democracy. Can we go next to the next slide? So the right to food, actually, I think we don't really need to talk too much about it, because I think that all of you already knows what is this right to food. But usually when we present our proposal, we take a little bit of this time to explain what it is. So, okay. And now for the collective, at the very beginning in 2017, there were several organizations coming from the agriculture, but also what we call in France, éducation populaire. Joshua, I don't know what the word in English for that, but it's people who work to give history, perspective of social fight and things like that, but also people who works against food insecurity, but by other means than charity. For example, VRAC. VRAC is an organization that collectively they buy food like grocery, and once a month they pay together, and then they distribute things, usually in a small quarter of town, in places what we call popular. So there were all those people who worked together, and what they were thinking, it's when we think to the right to food, the fact that agriculture has so much impact on the climate change, but also the health of people, that even the farmers who grows the food, but also all the workers in the food system are getting poorer and poorer, and that food banks are not more able to give food to enough people. When you think of this, the problem is systemic, macroeconomic, and if we only think by ourselves, even as big or national organization, we cannot find an answer. So they decided to put the things all together. And 2 years afterwards, they came with the proposal of social security for food. And then we can go to the next slide, Joshua. And it is really based upon food democracy and the work of Tim Lang, that said for the first time in the end of the 90s that when we think of food system and people as eaters, normally we should be able to have an equal and effective opportunities to participate in designing and shaping the food system. But this can only be based on a true knowledge about what are those food systems as they are now, and how we can change it. It can only be if we understand things. So you can go to the next slide. So the proposal of social security for food is based on an idea. You know that in France we have what we call the French healthcare, and it is a long history for us to fight and to obtain and gain those rights. There's a book written by Nicolas da Silva, who is an economist and a historian of health system. He wrote a book which is called La bataille de la Sécu, I'm not sure it's been translated yet. And he really explained the things from the French Revolution in 17th century, in the 18th century, at the end of the 18th century. Same, I think that everybody has heard about this moment and this event in history. And from then, there were what we call in France la mutualité. So it's how people organize themselves together to respond to healthcare, but also with orphanage, how hospital and all the healthcare system and how we product care was organized. And then how in 1945 things get different with what we call in France régime général and the healthcare system and how we socialized the cost of health was put together collectively like commoners. Actually, if we think about the commons, the healthcare system was really a common, and it was organized upon what we can call also healthcare democracy. The state hasn't had the power to decide. It was really only the workers, and it was really labor class. And how do you call Joshua patron, le patronat? I forgot the name.
Yeah, patrons are the bosses or like the corporate executives, CEOs.
Yes, CEOs and things like that. So it was only those people who decided how the healthcare system will work. And it's only in the 60s, at the end of the 60s, that the state put a representative in each department who will decide how we can spend this money. So it was really late. Maybe it was almost 20 years that only the workers and CEOs decided by themselves what was a really big amount of money, because all the salaries put together a part of their wages and decided how they will spend this amount of money. And it was almost half of the budget of the state. So maybe this we can go to the next slide. And I will finish on this point, and then it will be Juliette who will talk about what we are experimenting in France. The proposal of social security for food is really based on three things. The first one is universality, because the right to food really concerns everybody. It's not a public policy for poor people, but for every people who needs to eat. That means everybody. Then the second point is cotization. It's really the same for all our healthcare system. It's that every salary, every people who earn money, give what he or she can, and he will get the money of what he or she needs. So that's really a key point to our social health system. And then food democracy that I explained just a little bit earlier. And this food democracy, we are experimenting it through several initiatives throughout France. And we are trying to build really this right to food based on solidarity together, even if it's only small experiments. So Juliette, I'll let you can go to the next slide, Josh.
Thank you, Somhack. Yes, I'll only present you 4 of all of the experiments that are existing now in France, because they are the most advanced for now. So each of them have different types, because each focuses on one of the principles of this project of social security for food. For instance, on the left one, Montpellier, they ensure to include vulnerable people so that more than 50% of the members in the groups are vulnerable people. And in Montpellier, the group represents 300 people, and they are all contributing to the common fund. And their contribution ranges, for instance, from 5 to over 150 euros. So you have everyone that receives 150 euros, but that doesn't contribute the same amount. So this means some people contribute less and some contribute more. But this is how solidarity shows itself. And on the right, you have the town of Lyon. So they decided to experiment first with the students, and then they extended their members with a wider panel of participants. And in the next slide, you have 2 other towns that are also more advanced for now. You have on the left Toulouse. In this town, they experimented 4 common funds, different common funds in the city, both in urban and rural areas, to be able to see the differences between the 2 of them. And in Bordeaux, it's very interesting in this city because they experimented different levels of agreement with producers and retailers. For example, if a producer meets all of the criteria established by the citizens, then all of the cost of the project is covered by the common fund. But if one of the producer meets only half of the established criteria, then only 50% of the cost of the product can be paid by the common fund. And the rest must be in the charge of the individual. So with this, customers are more likely to opt for the product with 100% mutual fund. And this different degrees of price coverage by the mutual fund encourages producers to improve their practices so that the common fund can compensate for the full selling price. And so these experiments are very different for now, but they all have the same goal. It's to build the right to food based on solidarity and not charity. This is a big difference for what was existing before. And I think we'll stop here because we want to give time for your questions. And also know that these experiments are still going on, so we don't have the big results for now. The first will be in December, I think. So thank you for your attention.
There will be restitution of the first result for Montpellier in December. And Juliette, I think we will be there, both of us,
yes,
at the event. Yes. And maybe you can talk just a little bit of the work of Bénédicte, because she's your director for your PhD. And I think that all of her work can be really relevant in our group now for the discussion also, if you agree.
Yes, sure. So I didn't prepare, so maybe it will be more difficult, but I'll try. So Bénédicte Donzy is an anthropologist, and she made a big work on food aid. And she showed that there is a part of violence in the food aid system in France. The main reason is that when you are vulnerable people, you have to go to a place, you have to ask, you have to show how poor you are so that you can receive something. And she compared these kinds of several humiliations, small humiliations, but repeated during the year, during several years, in different types of places, when you can have aid to violence in how do you say this, couple violence, conjugal violence.
Double violence.
Yes, thank you. Because there are an accumulation of small violence that made something. And so this is quite difficult to hear, because all the food banks and Restos du Cœur, all the associations that are working to help people, they are doing, of course, for the greater good. But we need to keep in mind that this is an aid that comes with urgent situation, and that cannot be the way of having your nutrition every day, every year for 10 years in a row. And so this is what she based her work on. And she also was very present with the implementation of this project, the social food. Maybe you want to say something else, Somhack? Because
no, it's really great. Thank you, Juliette. And it's really hard for people to prove that they are poor enough to obtain this food aid. But also, maybe just one thing: the benevolence of these food banks and association also suffer from this situation. They came first because they want to fight against the actual food system, but actually they are seeing that they became a part of the system, that it's a way for those big agro-industry to not pay taxes, because it's really special, because in France there's a new law was promulgated maybe 8 years ago, and it allows all this the food system to be taxed for what they give for charity and to food banks. So it's even worse than before, because before they pay taxes because all this food will go to the garbage. And now what goes to the garbage goes to food banks, and they get back taxes about 66% on this part, which usually go to the garbage for them. And maybe just one last thing is that before that, in the food system and those big supermarkets in France, 30% of their of the food, of the fresh food, that means bakery, meat, vegetables and fruits, eggs, dairy things, everything, that means 30% goes to the garbage, and they can make money out of it even so. And now this part of this kind of food goes to the food banks, and food banks said that what comes directly from this food system and what is given to them, 16% goes to the garbage directly. Once they make they look a little bit more precisely what is given to them. So it's even worse. It's worse now that we have this system, and Benedict really shows that in her books.
Yes, and in other words, in before, where you have two problems, people that are needing help for food and food that are going to garbage, they assembled the two, and so by bringing two problems together, you can compensate one and the other. This is the way of the government, but this is not ethical.
It's not ethical, and more it's aggravating things. So I think that the work of Benedict Bonzi really deserved to be well known, not only in France but also worldwide, because I think that it's the same also in other countries.
Yes, and it's also very hard to hear. So
Very hot. Sure.
Well, you've come to the right place to find like-minded folks that are trying to elevate this issue. And I think it's really important to look at the French food waste law transition, because it is in advance in terms of European countries of what a lot of other European countries are now trying to do. But I also really, really love your presentation on these solidarity networks for thinking about weaving food access into auto taxation and Social Security payments. So we have about 15 to 20 minutes to open the floor for discussion. If anybody has comments or specific questions, please feel free.
Maybe before someone asks a question, we can really say that this food charity costs a lot in Europe. Third of the European money goes to what we call PAC. That's the Common Agricultural Policy in Europe. So third of the money goes directly to agrosystem, to the industrial agronomy and agriculture. And then the next biggest budget is 30% for food banks. So just imagine that 2/3 of the European money goes directly to this food system, and it's not either answering the climate change, and it's aggravating the situation, because since COVID, we really see that people are getting poorer and poorer. And now in France, people who get money each month and who are salaries, 17% goes now to food banks, because they cannot get enough money to pay for their own food.
Thank you. Emily, you have your hand raised?
Yeah, if no one else has a question, I do. So I thought I can ask. Maybe it will give people time to think. Well, first of all, thank you so much for sharing. I think this is such an important and very concrete experiment that's going on that really is in line with the right to food. So thanks a lot for sharing. I was wondering, you spoke a little bit about it, but I find one of the also really interesting parts of the food social security work is how peasant and food producing organizations are also so deeply involved as part of the organizers of this work. And I don't know if you would want to speak more about that and how from the perspective of food producers, how they're seeing it, how that's been to organize with them, or any reflection on that as well.
For the producers, we work with La Confédération Paysanne, who are members of Via Campesina. So yes, we work with them. It's more difficult to work with workers from the rest of the food system. That means those who transform or distribute food. It's really, I can even say that all those workers syndicates was at the very beginning against this proposal, and now little by little, because they understand more what is our proposal, they are coming to work with us. But for the producers, it's mostly Via Campesina. It's only in Alsace that we work with the main syndicate, but I can say it's really difficult with them.
Thank you. Area code 505, you have your hand up?
Yes. Oh, good. I didn't know how to work that. Bonjour. Good morning. This is Saida from New Mexico in the United States, and I've been listening by telephone, so thank you for presenting. I would like to understand more of how this is a solidarity, not charity model. That's very interesting to me in the work that I do with farmers. And I wondered if you could explain it a little more, how it's solidarity, not charity.
Yeah, good question.
Okay, I think it's really specific of what we are experimenting in the healthcare system. It's because, you know, in France, when I will just give a little bit points of history. Juliette, if you want to add something, you can, of course. Our healthcare system is a long history and a history of fights. After the French Revolution, people cannot get together in association to organize solidarity. What the state at that moment said, it was people has to be careful for themselves, each as individuals and not together, because they understand that because people goes together and they organize themselves in solidarity, they are getting more and more accurate about politics. So it was very, very harshly fought against at the end of the 18th century. And then during the 19th century, there were corporations and syndicates who organized themselves to socialize different kinds of things, like when they get too old with retirement, but also when you got accidents during work or maternity. And then at the end of World War II, something really happens more clearly. It's what we can call bourgeoisie in France. They were collaborators during World War II. And the resistance were communists, and those communists became even minister in France. And a man called Ambroise Croizat organized what is the key point and the basis of our healthcare system. And they decided to put different things together: unemployment, family, but also what we can call retirement and accident du travail and healthcare and those accidents during
Disability.
Disability. That's it. And before that, before this solidarity system, when you were disabled, it was or your fault or the fault as a worker or the fault of your CEO. But then they decided when it was the fault of the worker, he wouldn't get anything as money, and he cannot work. He is disabled and he has to stay to home and even to pay for his care. And the CEO, if ever it was the fault of the CEO, then he has to pay wages, even if the worker isn't at work. And with this system, we consider that it's not the fault of nobody. An accident is an accident. And when people are disabled, it's together that we can socialize the cost of it. And that's how it happens at the end of World War II. But actually, we can see the same way for the retirement. When you are old enough, whatever was your job while you were working, even if you haven't worked, for example, a woman who decided to stay at home and to take care and grew up their children, they will get this money. And by doing that, we get our eldest people out from poverty in France. And that was always thought, even nowadays, as solidarity and socialization and not charity. It's just normal, getting normal that when you go to a doctor and to hospital, that you pay quite almost nothing for the health system. Juliette, je ne sais pas si tu veux rajouter quelque chose sur cette notion.
Yes, maybe just to say that in anthropology, Marcel Mauss worked on when you give something. The thing is, when you have two people and one is giving something to the other, the one that is receiving something is in debt with the one that gave you something. And the one that receives, if the thing that he receives is something he will never be able to return, there is a domination that is going on in between the two of them. So this can happen with charity. If you are a vulnerable people and you all your life you receive something, you receive food, you receive aid, you receive access to rights, you receive anything, and you can never return back. With the charity system, you begin to feel humiliated, diminished, and you don't have your right in your position as a citizen in the society. Whereas the one that gives can take more power by giving much and much. So this is also some of the difference between solidarity and charity.
Yeah, and I think the effort to code all of this within actual public policy is interesting to me. In your 4 different case studies, Montpellier, Lyon, Toulouse, I would be curious to see the level at which the public coffers have also bought into this idea, or is that something you're still working on with the Caisse des Dépôts, and like at what scale has social security of food actually worked, or is it just 300 individuals choosing themselves to participate? But Kaylee also has her hand up.
Yeah, and yeah, thanks so much, Somhack and Juliette. And I think it actually follows on from your question, Josh, because I was going to ask, with the Montpellier pilot, you mentioned there were 300 people, some were paying €5, some €150. And I just wondered, like Josh, you know, how were people, were they self-selecting for that? And also, was there any sort of, you know, was it difficult to convince people to give 150 when other people were giving 5? I just wonder that sort of redistributive, you know, element with from people who are wealthier. I'd be interested to hear more about how that works in practice, please.
Yes, so Mac, do you want to say something, or should I?
No, go ahead.
Yes,
Okay.
I'd like to ask a follow-up question. I understand the gift relationship and Marcel Mauss and the sort of indebtedness that can come from a giver to a receiver and vice versa. What I'm interested in the projects in Montpellier, Lyon, Toulouse, Bordeaux, is where does income feature in these particular developments that you're working on? Do people, when they're accessing food, actually have sufficient money in their pockets to purchase their food in normal and customary ways, as you've been describing? It wasn't quite clear to me how this actually works in practice, in terms of having social security. Is it for food? Where does income security come in the context of the project?
Yes, it's a good question, because for now there are small experiments, so they cannot work without the aid of from foundation, from the collectivity, from the city, from the department. So the contributions of people is not enough for now, because they are experimenting the working of this kind of organization. So yeah, for now it's only 300 people, and this is the bigger group for now. So how do they self-select themselves, of how much do they contribute? So they, in Montpellier, for instance, they propose a grid of, for instance, your income, and you self-determine where you are in this grid, and you self-determine how much you're gonna contribute to the common fund. So for now, it is based on the how do you say, like confiance?
Yes, and confidence and trust.
Yeah, the trust. Thank you. So it's based on trust for now. But of course, if this social security for food was to be at a larger scale, like the healthcare system, of course, it cannot be based on trust by people. It is not the case with the healthcare system, and contributions are taken in the salary, and so people not choose what to contribute.
Sure.
But yes, and what was the other question?
Well, it has to do with
maybe I can answer to Josh.
Yeah. Mm-hmm.
In France, we talk a lot to senators and deputies, and some of them understand and some of them doesn't want to understand. And for them, they are really, we never say that socializing food is something like communism, because it's not communism. It's just a good sense, if we want to say that. But in the ministry, agriculture and economy, they doesn't want to hear about it. But Caisse des Dépôts are a true support for us, because Caisse des Dépôts really has a long history of mutuality and solidarity, and they know that socialization already given the proof that it can succeed. For example, what we call in France les centres hospitaliers universitaires. That means our biggest hospital, a public hospital in France, are paid by the healthcare system and its socialization. And we already has proven that it has good effects, because French people can get good quality of cures, of medication, and it was really a big amount of money. And what is really difficult nowadays is to understand that what we call the healthcare system deficit in France is actually built structurally because of the state and how it calculates the way things are going. We need to understand a little bit of macroeconomy to understand that, but there are no problem with the money actually in France for the healthcare system. The problem comes because the state wants that the healthcare system also pay what we call la dette souveraine. You know, after the Josh, how do you call that?
Yeah, just public debt.
Yeah, because you know the public debt actually just arrived after this big crisis with Lehman Brothers and the subprimes, and then every part of the state has to pay for this debt. But actually, it's not, this debt is not the debt of the healthcare system, but from the state. So that's really important to understand that, because there are no debts actually in the healthcare system nowadays.
But they're poaching from the healthcare system to pay financial debts.
Yes.
And maybe...
Yeah, I'm mindful of time just because we have quite a bit of planning for our Bilbao meeting discussion. But Laura, maybe you can take the last question.
Thank you. Thank you very much for your presentation. And I wanted to ask you very briefly, if you mentioned that some institutional responses to this way of approaching food security through charity. So you mentioned something with respect to the executive and the Congress, but I was wondering if, in your experience, there's been some responses from the judiciary of this. I don't know if there has been cases that have been brought to maybe the Supreme Court or other lower courts with regard to this, and especially with regards to the very controversial French food waste law. Thank you so much.
Juliette, je te laisse répondre. Tu voulais rajouter quelque chose en plus?
Yes, I just wanted to respond to another question. But okay, so I go to the previous question. one of you asked if what does it change for people that have the possibility to normally go to the supermarket and buy what they like. For some of them, of course, didn't change much because they already have the income, but for a lot of them, especially in Montpellier, where they made sure to have 50% of vulnerable people in the group, it changed everything for them, of course, because it was more than half of their budget for food. So of course it depends of the person, but so you could say that for people that for someone that has the possibility to pay his food, there is no change. But the thing is that the ambition of this project is not only to help vulnerable people, but it's also to finance the agricultural transition, because you can help producers and retailers that you choose to help. And this is a way to finance this, a bit like the healthcare financed public hospitals. And with the second question for the Supreme Court, I don't know, and I don't think it has been questioned yet. Also because the right to food is not, I don't know if you can say this, but opposable in France.
Mm-hmm.
So it exists in the international European level, but you cannot pursue the French state. Yes.
Yeah. There's no standing in court for the right to food yet.
Yes.
Yeah.
So maybe, Somhack, you want to add something about this?
Yes, and about this point, especially the state consider that people getting prevented from hunger is enough to answer the right to food. That the first thing, and they doesn't organize anything. If there are food banks, it's only because there are benevolence who works freely for the system. Otherwise, the state doesn't give money for that.
I'm not sure if I'm correct here, but I would be pretty certain that actually France, the French government, has obligations under international law to respect, protect, and fulfill the human right to food. And so I would think it was a justiciable question, a justiciable matter that it probably awaits advocacy, but I think France has ratified that convention.
Yes, France did ratify this convention, but you know, Graham, the charity and caritative model is really important to understand how in history, even ethics in France, it's really, there's a pressure about it because charity is considered to be a good thing. And solidarity and socialization of those topics, it's not even a question. We don't need to talk about that. But for maybe, I don't know, 10 years, there are people who are working about this right to food. And since 2 years now, there are a movement which is called Caravalim in France, who work for that because all those associations and organizations want us to get out from food aid to go to a right to food. Moreover, maybe things are getting a little bit different because now it's no more in discussion that climate change is a fact and a scientific fact, and that the food system is a key part of it. So if we doesn't change the way we produce a food, how we transform it and distribute it, it has an impact also on our environment, but also on people's health. So this is a little bit changing, and the context of the Anthropocene really changed things.
Sorry, I was just expressing my thanks for your lovely presentation and this discussion, and for bringing these issues and models up with us. We're now going to transition to the business part of our meeting, so I'm going to stop the recording.